Hi everybody, so today I'll be talking about pyloric stenosis. So first, let's break down the word itself, which has two parts. Stenosis, meaning the narrowing or constriction of the diameter of a bodily passage, and then we have pylorus, which is the lower portion of the stomach that connects the stomach to the small intestine, and this is a muscle. So pyloric stenosis is also called gastric outlet obstruction. And essentially what happens is the opening between the stomach and the small intestine thickens. So the muscles, the pylorus enlarges, thus narrowing the opening. And this can be really dangerous because food is then blocked from entering the small intestine. So people who suffer from this will, or most often babies, they vomit and for this reason can't get proper fluids or minerals, and they can get very seriously ill from this. Some notable signs and symptoms include that pyloric stenosis can cause forceful projectile vomiting, which is different from the normal wet burp that babies do. Another symptom is dehydration, and there may also be significant weight loss, and especially in babies, the babies may seem to always be hungry. They also may have irregular bowel movements, which may involve them constipation, frequent mucus stools, or just fewer bowel movements. May also result in stomach contractions as well. Sometimes you may also see insufficient urine production, and as well as with a physical exam you can see, or you can feel, a lump in the abdomen. Now, it's also valuable to explore the causes of pyloric stenosis. It's not entirely clear, but we do know that it's most common in babies less than 6 months of age. However, it is also notable that adults can develop it in something called adult idiopathic hypertrophic pyloric stenosis, or AIHPS. And this is a rare disease which is also underreported because of the difficulty of its diagnosis. We also know that pyloric stenosis is more common in boys, and it's actually 4 times more likely to occur in boys, and I'll get into a little bit why later. Pyloric stenosis may also be inherited or genetic, and we tend to see patterns with family history. It also is the most common race with pyloric stenosis seems to be Caucasians, and it is more commonly seen in premature babies as well. Some possible risk factors include smoking during pregnancy, bottle feeding as well, and possibly early antibiotic use. These are all just possible studies that have been conducted, and there is no definite link, but these may be risk factors as well. The most important thing to note about the causes of pyloric stenosis are that it undergoes something called multifactorial inheritance. So it is based on both genetic and environmental factors. And often in multifactorial traits, one gender is affected more, which is why in this case, males are 4 times more likely to get pyloric stenosis. And this is called a different threshold of expression. So the diagnosis of pyloric stenosis often involves multiple steps. So they may involve a blood test to determine the dehydration and mineral imbalance. May also involve an abdominal X-ray or abdominal ultrasound, and a barium swallow or upper GI series may be used to diagnose, which is like a barium enema but upper. Finally, well actually this is usually used first, a physical exam may be used to feel an olive-shaped lump, which would represent the enlarged pylorus muscle. So finally, the treatments for pyloric stenosis are twofold. So first, the fluid imbalances are treated with IV fluids. And then usually the treatment involves a surgical procedure, which is called a laparoscopic pyloromyotomy, which involves making an incision above the navel, after which point the surgeon cuts through the outside layer of the thickened pylorus muscle. And this allows the inner lining of the pylorus to bulge out, thus widening the opening and allowing for food to enter the small intestine. The recovery from this procedure, as in full recovery, is usually 2 to 3 days. Thank you so much for watching, and I hope you learned something new today. Have a good day!